I would like if you could introduce yourself and your credentials just so people have an idea of where you're coming from, your expertise on the subject.
Sure. Give me just a second. I wanted to, for a second, I thought my input was, nope, it's the right one. Okay, cool. Just want to make sure I had the right microphone. Um, Hello, my name is Dr. Kelli Dunlap. I am a licensed clinical psychologist. I also hold a master's in game design and teach game design to graduate students in the local university where I'm at.
Awesome. So, um, this conversation because I'm going to be posting the interviews for everyone to watch, so I might use clips from this in the main video. But this conversation is going to be about therapy in a general sense. It won't be getting into any one specific person. It's just going to be about therapy in general. So what's a good starting point here? I have a bunch of stuff written down, but it's not in order. I guess let's start with what makes something therapy.
So that's actually a really hard question, but I'm good to start there. So therapy is something that happens between a mental health, at least psychotherapy, between a mental health professional and their client. It is typically dictated by having a set time, a set place, an agreement for exchange of fee. So there's some kind of transaction that's going on. You're paying for a service. Therapy also indicates that someone is coming in with an issue and someone is going to help support them with that issue. And so it has very clear boundaries and rules that are required for something to be therapy.
Okay, so are you saying that therapy can't be free ever?
I mean, there are clinicians who do have a sliding scale or pro bono, like they can offer pro bono services, but that still comes with some kind of agreement between the clinician and the person receiving services that the cost of their service for this is zero. So there still is that contractual relationship between the clinician and the client. Because if you were to see somebody for free and then they just don't show up for 2 or 3 sessions, that's part of built into there. Well, then I can discontinue therapy because you're not showing up.
Mm-hmm.
So yeah, it can be free, but it has to be a discussion between the clinician and the person they're working with.
And you said also that like therapy needs to have a specific goal in mind of like working on a certain problem or something like that.
Yes. So if you are seeking mental health therapy, there should always be a treatment plan. So you're going in and you are basically agreeing to work with the clinician on a specific issue. It's not just coming in and talking about the weather, because that's a waste of time and a waste of your money.
Mm-hmm.
And so having like a targeted goal that you're working towards and generally having a strategy for working towards that goal is a really part of developing that therapeutic orientation goal and relationship.
So if a person walks in if it's just like a conversation just starts happening and there's no clear original goal in mind, it's just a conversation, and that conversation ends up being therapeutic, that's distinctly different from therapy.
I mean, context matters. So like if I'm in the grocery store and I'm just talking with someone
Mm-hmm.
and they, from that conversation with me, walk away feeling better, okay, that's great. I don't know if you would call it therapeutic, because therapeutic obviously has its own connotations of like, intentionally doing well by someone else, by helping someone. If you were to walk into my clinical office and you had an appointment and you and I just kind of sat there and shot the shit for 45 minutes, I mean, that would not be great for me as a professional. Because again, I want to be working towards something with you, not just hanging out with you. Like I'm in this relationship, you're not that person's friend. You're a provider and you are trying to help them achieve the goal that you're working towards.
Going back to that grocery store example, you're walking in a grocery store and you bump into someone and have that conversation that ends up help. Like, were you giving yourself as an example there, or just saying in general?
Sure. I mean, it's hard because if it's any random person, then I can't really speak to it because most random people don't have the level of clinical training that I do.
Right. That's
I have
why
a
that's why I wanted to make a distinction, because it's just like I was gonna ask if someone goes to a grocery store and they say, like, they have a conversation with someone and they say like, oh well, I'm a psychiatrist, but this isn't I'm not providing you with any medical advice, I'm just talking to you or whatever. Like if somehow it's understood that that person is a psychiatrist, but it's also just a conversation.
So that's when we get into this tricky part of it doesn't have to be therapy to look like therapy. And that is the big ethical pitfall that clinicians often face if they are in, say, public life. There's an entire rule set for mental health providers who want to speak in public, who want to go on, talk shows and, things like that. If it appears to be therapy, that is good enough to trigger ethical standards. So in some clinicians may disagree, but in my brain and the way I practice is that if I'm introducing myself as Dr. Kelli Dunlap, or I'm disclosing to someone that I am a psychologist, I am therefore bound to act within the roles that my title gives me.
Just by introducing yourself as doctor.
Yeah. So if I'm in the grocery store and some lady comes up to me and we just start chatting, and I'm just Kelli to her, and I'm intentionally not using my clinical toolkit because I don't do that. That's some really ethically gray waters there. I'm just being a nice human and like maybe providing some validation, some support, or even like, hey, have you checked out this resource that might help you with that?
Right.
Like, that's fine. I'm just talking to her human to human. The second I cross that line by either introducing myself as a psychologist or moving into using skills that I have solely because I have trained as a psychologist, I am now using the skills that I have and the legitimacy that I have in order to talk with this person. I'm now bound to those licensure and those ethical requirements because I am acting or presenting myself in a way that says that that is my role.
Okay, so you mentioned that there's like a set of rules for public speaking when you're for therapists. Could you maybe briefly go over what kind of stuff is in there?
There's a lot and also not very much at the same time.
Okay.
So ethics generally has a lot of gray area. There's very few things that are ethically good or bad, right or wrong. There's almost always some wiggle room in there, and it's a constantly moving target. So you kind of have to do the best you can in the situations that you're in. So if you are someone who is a mental health professional and you're licensed and you are, using that license or your knowledge or your role as a mental health provider to dispel public information, that's actually encouraged. Like, mental health providers are encouraged to speak about issues that we know about, because who's better to educate the public about mental health than mental health providers?
Right.
Like, that's kind of one of our duties, is like, if you have this expertise and you can speak about it and educate, great. You should absolutely do that. However, there are lines between when does it cross from being education to being like specialized information, to being treatment, to being diagnostic. Those are no-nos, because those only happen between a client and their contractual, within the contract of their mental health provider.
Right.
So one of the difficulties is that the rules and regulations around mental health providers acting in a public space, they are not very well defined. This is not a topic that psychology particularly has delved into a lot. And so there's a lot of unknown. There's a lot of gray areas. And so typically, at least for me, I try to practice what I consider to be ethical, legal, and smart. I'm always trying to hit that trifecta. So just because something is legal doesn't mean it's smart or ethical. Something can be legal and ethical doesn't mean it's a smart thing for me to do either. And of course, any part of that triad, if you can. So hitting all those is really important when you're in that public sphere, because there is not a great deal of guidance.
How would it even come up, though, in like a public sphere that you're, because like what I'm picturing when you say like a public sphere, I'm picturing like someone on a talk show, for like, right? And on a talk show, how is someone going to end up in a situation where they're in a sort of contractual agreement of therapy? Because aren't they just going to be talking about, if they're on a talk show, I feel like how could they end up getting specialized as opposed to just being general?
The clinician or the person calling in?
The clinician. Oh, so you're talking about like a call-in show. Okay, I got you now.
Call-in show, yeah, something where someone's asking something of you. And so, of course, if it's like a talk show and there's a host asking you, so Kelli, tell us about depression. I can very clearly educate, this is what depression is. Here are common symptoms of depression. Everybody experiences depression differently. If you think that you're having difficulty with depression, here are resources that are available to you. That's all kosher. That's all above board. That's me using my expertise to educate and support the public. Now, if that person was to ask me, hey, I'm experiencing symptoms 1, 2, and 3, what should I do? We're now encroaching on ethically squishy territory because I am a provider. And so whatever I say is going to have clinical weight, no matter how many disclaimers I have. Like, it's important to, at the start, always clarify your role. Yes, I'm a clinical psychologist, but right now I'm just, here to educate. I'm not anybody's therapist. I'm just here to talk about mental health. It's important to clarify your role and like what you will and won't do. And so if someone's like, hey, I'm experiencing these things, what should I do? We start to get into like, okay, well, I can tell you, well, it sounds like you're struggling with something. It might be good to go talk to someone. Here are ways to get in contact with a mental health provider. That's like the safest route. And then there's people who will say more than that, or they will ask for more than that of, oh, I've struggled with depression for a really long time. And I tried CBT. What do you think of CBT? Or cognitive behavioral therapy, which is a specific treatment modality. Well, now we're talking about specific treatment. And that is inherently, we're now going away from general education to specific treatment possible recommendations, which is definitely something that is not okay. And that's largely because they're not my client, but I'm using my skills and my knowledge as a mental health provider to give information to this person, to give treatment to this person, to make recommendations that could be taken as medical advice when they're not my client. And that's just not safe. That is just not safe.
And advice, like saying something as simple as, I think CBT is great, is already encroaching on that territory?
It could be. Again, it's gray. Like, I will tell someone I'm CBT oriented. That's how I was trained. So I think it works really well. It worked really well for me, but other people may have different experiences. So I am addressing the issue, but I'm also qualifying that it's not a one size fits all. I can't go out there and say CBT is the best thing out there and everyone should use it.
Right.
There's absolutely no way I could know that. Even just one person, I have no idea if CBT is the right fit for them because I haven't talked to them. I haven't done an assessment on them. I have no idea if that's a good fit for them.
Right. So basically, like the show Frasier, what he does is technically not okay in the show. Obviously, it's not real, but.
So I've never seen Frasier.
Okay, so Frasier.
So I'm familiar with the premise. Like, okay. I know that he's I think he's a psychiatrist.
He's a psychiatrist,
and he's got a call-in talk show.
Yeah.
Yeah, and so, but I can't speak to that because
Well, he helps people. People will call in with a specific problem, and he will give them advice.
It would also depend on whether or not he's licensed.
Right.
So, for example, I'm a licensed practitioner, which means that I have to abide by the rules of my licensure and the ethical board that governs it. If someone does not have a license, like Dr. Phil, not licensed, he can say whatever he wants because
right.
There's no regulatory body saying that this person is legit. And in fact, Dr. Phil has tons of ethical complaints against him. And he is firmly seen as, for a large amount of people, just entertainment.
Yeah.
So that's kind of where that differentiation comes from, is that if you want the legitimacy of a license, you have to abide by the rules that licensure says that you have to practice by. So I don't know if Frasier's licensed or not.
So with the license thing, does that, like, for example, like, you can be licensed in one state, but that doesn't mean you can practice necessarily in a different state. So
absolutely.
If you are licensed in one state, but you're currently in a state where you're not allowed to practice, and you introduce yourself, your credentials, and then go on to have a conversation that is therapeutic, are you, like, does the license thing count towards that, basically? Or it's like, because you're licensed therapy?
Because you're licensed, you have to, at least in my opinion, you have to treat yourself and the words you give as having greater value and weight than
right.
someone who is not licensed nor a mental health provider. Again, no matter how many disclaimers you make, if this person sees you as a doctor, as a clinical psychologist in my case, and I'm telling them things like, hey, you should look at this, that, and the other, it doesn't matter if I'm like, well, I'm not technically in my clinical role right now because I'm out of state and I'm not licensed in the state, or, I can't practice with somebody who is in a different state, and every state has different laws around it too. So it's actually very complicated
Hmm.
of who you can see and when and for how long. Um, but if it was this talk show thing, if I'm licensed and on a talk show, I am not going to be giving any kind of clinical recommendation. Like, it's going to be purely education based for me because I don't know where that other person is coming from. And I would never give out advice, whether it's clinical, whether it's diagnostic, whether it's certainly not medication advice to someone who I don't know, regardless of what state they're in.
Right. Um, what you're saying is that it comes down to what you're saying in those conversations and the perception of due to your credentials, even if you're
Mhm.
not licensed. So, like, for example, if it's someone's like a licensed doctor in a country that isn't America, but they're not allowed to practice in America, uh, you're saying that people will still perceive them as having medical authority, even though they're not, and that is like unethical, even though they're not able to practice in the country that they're currently in.
Yeah. If you are giving the patina, if you are giving the appearance of doing therapy, even if it's not therapy, and even if you have given disclaimers, if it looks like therapy and smells like therapy, and the people who are tuning in to your show refer to it as therapy, if it gets covered in the press and the person is introduced as, hey, here's Dr. So and so, doing therapy for whomever,
Hmm.
like there's obviously a perception problem. And as a clinician, you can't obviously control what people perceive 100%, but then you have a duty to correct that perception. So, for example, there was one time I was cited in an article and I was called a PhD. And I had to write to the article and say, no, you have to retract that. I have a PsyD. It's different.
Hmm.
So even something that smaller, if someone says Dr. Kelli Dunlap and it's not immediately followed by clinical psychologist, I have to, out of due diligence for myself, contact that organization and say, hey, I need you to change this because that's false representation. If it's
Right.
just Dr. Kelli Dunlap, someone may mistake me for a physician, and that is unethical. And so I have to do my due diligence to make sure that that doesn't happen. You can't be 100% of the time. Sometimes people won't rewrite. Sometimes people just ignore you. Even if you are very clear about from the start what your qualifications are, like, stuff can get mixed up, but at least you're doing something to try and resolve the issue so that you're not giving a false perception of your credentials, of your skills, or what people can expect from you while you're talking with them.
Right. So you mentioned that there are certain tools that a therapist has, and that
Mhm.
using those would make something therapy. Could you go over what those tools are?
Is that a trick question?
No.
No, I'm just kidding. I'm kidding. So, for example, it really comes down to the training that you've received. So, like I mentioned, I am cognitive behavioral based in my training. I have a lot of other stuff that I've acquired over the years of my training. And so, when I'm talking to someone as Dr. Kelli Dunlap, clinical psychologist, there are certain questions that I'm going to ask. And the goal of those questions is to peel back layers, it's to uncover what's underneath. It is to understand the origin of where things are coming from. It's to discern patterns and themes and what people are saying and see if I can help them connect their own dots. I do not do that with anybody who's not my client. If a friend comes to me and is like, Kelly, I'm stressed out, my boyfriend is da 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 da, then I'm there with them as a human. I'll be like, yeah, that guy's a real dirtbag. And, just, I can have opinions and I can have judgments and I can, give my thoughts openly. But that's because I'm not asking clinical questions. Clinical questions are intended to get you information that that person may not be aware of or know of. And so that's a huge distinction between, like, hey, how are you? General question. Hey, when was the first time you felt like that? Is there a family history of that? Those do not come up in like normal, like, tabletop conversations with human beings. Those are questions that come out of clinical training, specifically targeted at getting information from somebody, even information that they may not be aware of.
I mean, couldn't it be argued that, uh, let's say someone who's not a doctor, not a therapist, but just has like this natural propensity for uh, human behavior, I guess, and they sort of like figured out that asking these questions can help them help their friends in conversation. Because I've actually like asked my friends similar questions before, where I'm like, I'll see they have an issue, and I'll kind of be like, oh well, what about like I'll try and get them to connect it back to something like deeper, because I'm seeing it, but maybe it's less obvious to them because they're in the thick of it.
I mean, one question is a question. A series of questions that has a targeted goal at the end, that's a clinical line of questioning. And so, yeah, you may have really good empathy and you may have really good insight into your friends, but you're also, I'm assuming, tell me if I'm wrong, you're not a mental health professional.
I'm not, no.
Your friends are asking you for your advice. You have their consent to do this. And it is very, very clear that there is not a power dynamic, that you do not inherently know more than they do when it comes to things like asking those kinds of questions. Whereas if I were to do that, there exists an inherent power dynamic that if I'm talking with someone, whether it's a friend and I have their consent, I'm still Dr. Kelly. I still, have studied for 5 years to get that clinical doctorate. And so that kind of goes back to that idea of I am always hyper aware that whatever I say could be taken as clinical advice, which is why I'm always so careful with what I say, because I would never want anyone to hear me say something and then extrapolate that and apply it in a way that is inappropriate and could cause harm.
I know that there's like a code of ethics from the American Psychologist?
American Psychological Association.
Psychological. Yep. And there's also like a Psychiatric Association.
American Psychiatric Association. Yep, those are two separate bodies and they have two separate ethics codes.
Are they wildly different, those ethic codes?
They're not wildly different, largely because you are still functioning within the realm of dealing with the most vulnerable parts of people's experience. I have not studied the psychiatric ethics code because I'm not a psychiatrist, and so It's never been of interest to me. But I am a very strong advocate in terms of the American Psychological Association's ethics code, and applying that to my individual practice. I apply it to my game design. I teach ethics from that standpoint when I'm working with my game dev students or game developers themselves, if they're trying to create, games that have like emotionally intense content that could possibly trigger someone. I work a lot with those individuals of like, okay, well, here's what the ethics code says around, the potential for harm and how can you reduce risk around potential for harm? What are the safety measures we can put in place so that one, the likelihood that someone is triggered is very low. And if they are triggered, like there are supports along the way to help them.
What do you think would be some of the key points on the code of ethics that are relevant to the discussion of blurring the lines between therapy and conversation?
So one of the biggest ones is informed consent. So like if you are working as a mental health professional in a therapeutic capacity, the person you're working with has to consent to that treatment. Otherwise you can't do it. And so if that consent has to be there, that's like a bedrock principle of any kind of therapeutic relationship. And so that's kind of that idea of, doctor-patient confidentiality. And that's what gets tricky when you're in a public space, is that if you have a contract like that and you've established client privilege, then you absolutely should not be talking about the client in public, because that's a violation of privacy. That's another bedrock foundation, is what we call confidentiality. That means what's said in this space stays in this space, with very, very few caveats to that, because people will not open up if they don't feel safe to do so. And so that's part of that sense of safety around it.
It is technically possible, though, right, for therapy and a therapeutic agreement to take place with consent, of course, in a public setting where people are watching. Or no?
Are you saying do therapy in a public space?
Yeah, like if the client consents to being in a public space, people seeing it, and I guess you could say like foregoing a sense of confidentiality in that way. Like if the client agrees to it, is that okay?
Wow. It's hard to imagine a situation where you could justify that. Because therapy is about the benefit of the client. It's not about me being on TV. It's not about me getting attention of what a good therapist Kelly is. Like the point of therapy is to serve the best interest of the person you're working with.
Right.
And I would have significant concerns about something being done in a public space. One, because yeah, you can waive your right to confidentiality, but do you really know what you're doing? Like if you're on a show and someone is asking you these clinical questions and something gets triggered in you, do you really want that captured on television or on stream for people to replay and to relive over and over? There are questions that we ask as clinicians that, if somebody wants a transcript of the session, like we don't do that to begin with, but if even if we did, we'd have questions like, well, what benefit is this to you? If someone wants copies of all of their notes, there is grounding in the ethics code that if you think this could be harmful to the person, you can say no. If someone asks something of you and they have given you consent, but you think that it could cause harm to them, as a clinician, your job is to prevent that harm. So even if they want it, even if they waive their consent, you can still say no to things. And so the idea that somebody would go to a mental health professional, want to have these kind of conversations in this very public space, I would never do it. I'll say that. I would always say no to that because I don't see it of being of benefit to them for it to be in public.
Mm-hmm.
Like opening yourself up in the way that we do in therapy, that is an incredibly intimate and private thing. And so if you want to put that on blast, you'd have to give me a really, really compelling reason,
right,
of why you would intentionally put yourself, why you would waive any kind of protections and put yourself in a position where harm is incredibly possible as the client. And then as the clinician, I would have questions around why are you letting them do that?
So I guess a good way to sum that up would be that like doing that is incredibly risky, and while it may technically be doable, it would require very good justification in order to be done.
Yeah, and I mean that's ethics in general. It's like so to me that it may be legal. So what you're describing, it may be legal. Ethically, probably very, very gray, probably in the darker shade of gray. Is it smart? Absolutely not. I don't know about anybody else. I've worked really hard to get my degree and to get my license. And those are things that I am very protective of because I have worked very hard for them. And it also lets people know that like I'm an ethical practitioner because I abide by these rules. And to just go, nah, I'm good. That's, again, it may be legal. Ethically, again, it gives me kind of the creeps. But there's not anything in the ethics code saying thou shalt not do that.
Right.
So you could maybe make a justification, but it's certainly not smart if you care about your license or your status as a professional.
And of course, most importantly, how it could affect the people hearing it.
Oh, well, yeah, I mean, of course, because that way, like one of the things that always, has confused me or made me quizzical about this kind of work is that if you're working with someone one-on-one and you're doing this kind of work in a public space, the information you're giving is for that individual person, and you have absolutely no control how any viewer takes it.
Right.
And that just makes things work
themselves or something.
It makes it so much more complicated because there's no such thing as like mass therapy. I guess you could do groups, but even then, those are like 8 people and they're really targeted and they're really small and you're not making individual recommendations. You're making more broad general recommendations. And so, you have to be mindful of the health and safety of the person that you're working with. And if there is an audience, mindful of the people who could be watching and what they could possibly be taking away from what you're saying or what that interaction is like.
Right. This is okay. So I'm a little bit unclear on this. This is something that came up when I was researching this. Correct me if I'm wrong, but my understanding is that the APA does not actually have any governing power at all, and that you can just break any of the codes of ethics that they have, and that they can't stop you from practicing.
So the APA, that is correct. Technically, to the letter, that is correct. However, if you get an ethics complaint via the APA, and then the APA sends that to the ethics board, not to the ethics board, to the licensing board,
right?
Which they will and they do.
That's
so no, the ethics code has no teeth other than to inform the licensing board that you have violated your license. And then the licensing board can come after you. And that's not just like possibly losing your license. That can be civil suits, that can be lawsuits, that can be malpractice.
I
So
see.
you're right. Yes, to the letter, the ethics code has no teeth other than to inform the licensure board, which does.
Okay. So ultimately, it's not that different. It's like you break their rule, their code of ethics, you are getting reported to the people who care about it. So that's kind of
Yeah.
a relief to know, because when I first just when I came across the information that like the APA can't enforce anything, I was like, what the hell? Like, why is there an ethics code that doesn't matter? No, but it's good to know that like there is some sort of accountability there.
Yeah, it's the guidelines that govern how we can practice. And so again, since ethics is so squishy, there's very few things that it's not like you break a law, like you sped or you didn't. Ethics
Mhm.
is never that clear. And so if you break an ethical violation, it gets reported, and then the licensing board can decide how they want to do that. And again, because every state has different requirements in terms of ethics. So, for example, when I got licensed, I'm licensed in Maryland and in Virginia. They have two different ethics codes. Each state has its own ethics code and its own rules for licensure. And you have to know those if you want to practice in both those states. And so, across the country, every state's going to be a little bit different about what they require, which is why it's left to the licensing board as opposed to a giant entity like the APA, where you can't really take specific laws or codes in a district or a municipality or a state into consideration.
So if you were doing something that was being broadcast across the entire country of the United States, you would have to be within the ethics code of each state at the same time, basically. You'd have to be you can't be breaking any state's ethics code at any point.
That is the tricky part of doing stuff remotely, is
Hmm.
that, yeah, typically, um, typically you do have to be mindful of that. So, for example, I have a colleague of mine who has a doctorate in clinical psychology. And in most states, I think like 48 of the states, if you have the doctorate, you can call yourself a psychologist. You can't call yourself a clinical psychologist because you have to be licensed to do that. But you can call yourself a psychologist, except in California, where you can't. And so when this colleague of mine, if he ever gives a talk on whatever topic and he introduces himself as, Dr. Whomever, he has to follow it up that he has just the degree and not the license.
Right.
Because in the state of California, he can't call himself a psychologist. So he has to make a forward. So he calls himself a doctor of psychology, which is safe. And it's obtuse and it's wordy, and most people do not care.
Or know what it
Um,
means.
or know what it means. And like, I don't blame them. I wouldn't know this stuff unless I had to.
Hmm.
So, as someone who does stream and I do a lot of talks and I do a lot of presentations internationally, like that's always on my mind of like, I was in India and I'm like, I have no idea what the ethical guiding principles of
Right.
India are. So I just need to stick to that smart, ethical, and legal to the best of my ability. And no one's going to be perfect. I'm sure I've messed up sometimes and said things that I'm not meant to. And like, I hope that people forgive me for anything times I've messed up. But like, if you are actively trying to do right by the people you're working with, and if that's the person in front of you, great. And if there's an audience involved too, then they also are a part of that. And you have to do right by them as well, because your words do have weight and they do have meaning.
Okay, we talked about a lot about what makes something therapy, but what about what makes something not therapy?
So, I mean, therapy, at least to me, exists within the room or the telehealth session. There's a contract. There are very clear rules. I am the psychologist. You are the client, and there are expectations. Anything outside of that is not therapy, at least to me.
Okay.
It doesn't mean it doesn't look like therapy. It doesn't mean that someone might not interpret it as being therapy or talk about it as being therapy. But that's the differentiation. Therapy is a word that has a lot of meaning and has a lot of structure that's required for it to actually happen. And anything less than that, it's people using therapeutic skills or training outside of a clinical context for whatever reason.
So you're saying that people can use therapy skills in a way that isn't therapy? Or am I
You could
misunderstanding?
absolutely hurt someone. Like, if I decided to, go like chaotic evil and just start offering free therapy on the street for funsies and making recommendations and diagnosing people and saying, oh, you're taking X medication, you don't need that. oh, your doctor told you have this disorder. They don't know what they're talking about. You can trust me because I'm a licensed clinician. Like, that's certainly not therapy, but it is using my skills and my training to give information that has clinical context to it that could be taken as clinical advice. And that would be very, very bad.
Okay. I'm trying to find a way to, well, we got to keep this general, so I'm not even going to go there.
If you want to ask me a direct question, I can tell you if it's off the record or not. Like, if it helps the process of understanding or like wording it in a way that I can answer it, I'm happy to do that off the record, if that's helpful.
I was thinking if a person like Dr. K was on stream, but he's not meeting certain requirements to make it therapy. It's not private. It's not, there's no original goal in mind. He doesn't even know the person necessarily before he speaks to them, stuff like that.
Mm-hmm.
But he does use therapy tools in the conversation. It sounds to me like, from the way you were describing what is and isn't therapy, that he's technically, even though what he's doing is dangerous, or can be dangerous, it's technically not therapy.
Yeah, I would agree with that. Okay. I think I mentioned earlier too that therapy is a very specific thing. Mm-hmm. But just because it's not therapy by the letter of the law doesn't mean that it can't do harm, or just because it's not therapy doesn't mean that it's appropriate to use those skills in a non-clinical context. And so, it doesn't have to be therapy. But again, if it looks like it, if a random stranger walked in and was like, oh, wow, that was a really good therapy session. Or if it gets covered in the media as, look at this person who's doing therapy on stream. Right. That's a problem, because then the perception, no matter what you say, the perception is that it is therapy, which means whatever you are doing is coming across to a large amount of people as representing that this is what therapy looks like. This is what therapy is. And so not only is that potentially harmful to the person that you're working with, because if it feels like therapy to an audience, it probably feels like therapy to the person you're talking to. There's no accountability of anything. You're just using the skills that you have without the guidelines that inform good practice, that inform safe practice that is in the best interest of the public. It also can make therapy look really bad. So if you're a really terrible therapist and you're doing therapy or pseudo-therapy and you're really bad at it, well, then you're going to make the entire profession look bad too. And people are going to think, oh, well, that's what therapy is like. It's like, no, that's not at all what it's like. And that's literally in the ethics code, that if there is the appearance of therapy, or if there is the appearance of like the profession in a bad light because you are misrepresenting yourself in some way, you have a duty to fix that.
Okay, so basically, it doesn't even matter if therapy entertainment is technically therapy. It just matters if people perceive it as such. Well, not just matters, but that's like one of the biggest factors, is the fact that if people are perceiving it as therapy, then it's already unethical according to the APA.
Or at least incredibly ethically questionable.
Right.
And you would want to think long and hard. Like, I think we talked about Dr. Phil earlier.
Yeah.
Like, I think it's wildly unethical that he has a show. But that's me personally, and I am not the ethics board. And again, he's a different kind of doctor. I don't know the medical ethics code at all. But like, people do listen to him, and they do take what he says to heart. Mm-hmm. And I've unfortunately seen his shows, and it's not good. You sit there going, why are you doing this? Why would you ever say that to someone? Why would you recommend that? Like, that sounds incredibly harmful to me, just from where I'm sitting. So yeah, there's this idea of, okay, well, it's entertainment, but people still take it seriously. Like, my grandma listens to Dr. Phil and then comes and tries to talk to me. And I'm like, no, this is very, very wrong. It's just factually incorrect half the time too. But it's because it's done for entertainment. And to me, that's a really important reason why therapy, like actual therapy, could never be done in a public space. Because if there are viewers, then, and your client and you, then who is the actual client? If you're in entertainment, who's your actual client? Is it the person you're talking to? Or is it the audience that you are trying to entertain and you're trying to retain viewers and you're trying to get those sweeps numbers, to use the old TV terms, which is why people like Maury Povich and Dr. Phil have these outrageous scenarios on their shows, is because the person they're interested in isn't the person they're pretending to help. It's the numbers, it's the viewers. And so that, again, like, who is your client? Who is your ethical obligation to? And if it's not the person that you're prying information out of, that feel like I literally have goosebumps. Like, that feels so uncomfortable and so gross to use your skills in that way.
So hold on, just take a second to think here.
Sure.
Does that mean that, like, if there's any question of motivation that goes beyond "I'm here to help blank person," this is where it gets confusing, because it's like, now on one hand you're saying that someone like Dr. Phil is not technically giving therapy, but they are doing something that is going to be perceived as therapy.
Mm-hmm.
So even if something is perceived as therapy, once motivation comes into question, that's already like a no-no, is what you're saying. Or am I missing?
I mean, if it's perceived as therapy, it's already a problem.
Right. And then the added layer of, because it's like, if it's technically not therapy, then is it a problem that the motivation, but I guess if it's perceived as therapy, it doesn't matter. Someone like Dr. Phil, because like you're saying, and I agree with you, it's like pretty obvious his motivation is not, at least, I'm not gonna make a definitive statement, but it's not obvious that his motivation is to actually help the person. It seems like his motivation is to get numbers, get ratings. So that, you're saying, because he's perceived as therapy by people, that's what makes that unethical.
Yeah, unethical and problematic. And the thing is, because he's not licensed, the ethics don't matter, because there's no board to enforce, as you said earlier. There's no licensure board that can enforce those ethics violations. He does open himself up to like civil lawsuits, and I know lots of people have launched complaints and lots of people have sued him for stuff that has happened. But that's a different matter, and I'm not a legal expert at all. But yeah, that's the main thing with Dr. Phil, is that he can pretty much do whatever he wants because he's not licensed, because there's no regulating body telling him that he can't.
So what are the main ways you think that the lines can get blurred such that people viewing or on the receiving end could end up misperceiving it as a conversation as therapy?
I mean, the easiest thing, at least from the clinician side, is don't ever give advice. Just don't.
Don't give advice.
Don't give advice, and don't make,
you mean like specific advice, right?
Advice that would be specific to that person.
Okay.
So yeah, just don't ever give advice, and don't ask questions that come from your clinical training. Like, if you wouldn't ask them at like a cocktail party, you probably shouldn't ask them in a public place of someone else either.
Right.
That's probably the easiest way of, like, if you're sticking to education, you're fine. Like, again, you can talk about depression and its symptoms. You can talk about psychosis and its symptoms and how it manifests. And if someone calls in and is like, oh, I experienced that, it's okay to have empathy and to be a human and go, that sounds like it was really, really hard for you and you went through something really difficult. And, have you considered reaching out to a mental health professional? Or it sounds like, CBT didn't work for you. Are you aware that there are other modalities out there? Are you aware that you have these, options and choices? Do you know that these resources exist? Like, that's all fair game, because that's all, like, that, again, that just falls under education and informing the public. But if it's one person and you're like, okay, let's talk about your childhood.
Right.
You're no longer informing the public. You are doing a deep dive into someone's very personal experience. And whether or not you want to call that therapy, I don't know. If you want, but like, is it perceived as therapy? Do people walk away from that thinking like, okay, yeah, that was a great session? And the way you mitigate that is like, okay, have you made it very clear what your role is? Have you been very clear to like stay away from definite no-nos like diagnosis? Like there's absolutely no reason any mental health professional, licensed or not, should ever give a diagnosis or medication recommendations. Ever. That is between a person and their physician. That is
And
like
a
that's one of those
diagnosis
hard lines.
is not just like you have blank, but it could also be you don't have blank, right?
Yeah. Like if you were to say something like, oh, if you and I were talking and you told me like, oh, I had a really rough day, I got my assessment results back and it says that I have, let's pick one, generalized anxiety disorder. And I'm like, okay, we've been talking for 5 minutes. I don't think you have GAD.
Mm-hmm. That's a diagnosis.
That is me as a nobody refuting your physician's assessment.
Right.
And so again, there's that kind of double bind of if I know you well enough because I've assessed you well enough and thoroughly enough to be able to make that kind of recommendation, then we are in a very different relationship than just two people talking. Because then I have collected a ton of information on you, your background, your history, your past experiences. That's not a conversation that you have in a supermarket. Like that's a conversation you have with your medical provider, whatever kind of medical provider that is. Mm-hmm. So if you've got the expertise, you shouldn't be doing it in public. And if you don't have that expertise, you shouldn't be assuming that you can make recommendations about people's treatments or, diagnosis or like their medication status. Like, oh, I think you should go up to 20 milligrams of this. No. Not danger. Do not do that.
And so if someone that you're speaking to becomes, there begins to appear evidence that based on what a doctor or someone who has the credentials of a doctor, even though it's not, they're saying it's not therapy, says stuff to a person, and then that person, there begins to be evidence that that person is questioning a previous diagnosis, or saying like, are you saying that that I don't have this blank whatever disorder or whatever it is? That's already way too far, is what you're saying?
So just to make sure that I've got it right, I am talking with someone in a public space.
Yeah.
And they're telling me about their experience, and they're telling me like I have generalized anxiety disorder. I'm thinking that doesn't sound like GAD. Are you asking me, is it okay to tell them that?
Well, what if you said like, well, it seems like you actually are exhibiting like, it seems to me like you're struggling with this problem that you have with I don't know, you're talking to someone there, you say like, oh, it kind of sounds like to me like you're just having some issues dealing with your parents right now, and that like maybe you have GAD, but I think you also have this thing going on top of that.
Hell no. Hell no. And I say that as a provider. Like if you're a mental health advocate, go for it. If you are just talking with a friend, that's fine, because you're making observations that are not based on clinical training. There is no way in the world it would ever be okay for me to go, I think I'm hearing that you're having a problem and you're having these symptoms, and that your current physician or psychologist recommended GAD, but you know what? It really sounds like PTSD to me. I have
what if you're saying like, maybe you do have GAD, but you might also have PTSD. That's too far, right?
That's diagnosing. That is me exerting my clinical opinion, because you can't give a diagnostic like that.
What if it's not like, instead of PTSD, it's something that's not a diagnosis, something that's like, oh, it sounds to me like you just need to go talk to your brother because you got in a fight and like that's troubling you.
Then I am making individualized recommendations about that person's experience, and that's treatment. For me, that falls in, again, other mental health professionals may argue, and again, it's not hard and fast, but instead of, sometimes when we have a lot of anxiety, sometimes it can be really helpful to look around and see what else is going on in our lives. We can get stress from family, we can get stress from friends, we can get stress from work. That's broad, that's generalizable, like that's an education-based thing.
Yeah.
But if I'm saying you specifically, it sounds like you have this, and I also think it could be that. This is no longer education. It's no longer broad providing of information. I am making a specific observation and possible recommendation based on your individual experience, which is only something I would ever do as a mental health provider with somebody who is under my care.
Okay. That clarifies it for me, I think. Basically, if someone says, if a doctor, even though it's in a casual conversation and it's known that they're a doctor, is saying something like, you may have depression, but I think that you have like a lack of purpose in your life because, you feel, it sounds to me like you need purpose. You may have depression, but it sounds to me like you need purpose. That's getting into individualized recommendations.
Yeah, because you're literally talking about that individual person's experience.
Okay. That's very good clarification for me. Because I do think that type of thing comes up in the subject of this video. So,
and the other thing to keep in mind is, who are you to say that? Like, if you're someone's friend or a close family member, then maybe you have that insight in that background on that person. But if you're just a random person who this person's talking to, and you've been chatting with them for like an hour or less, who are you to be making those kinds of judgments again on someone else's lived experience? Unless you are utilizing the clinical tools provided to you as a mental health professional to dig into that kind of information.
In which case,
which then goes into individual treatment. Yep.
Right. So the only way you could really have a grounds to even be saying that stuff is if you are engaging in therapy, which you're not supposed to be doing without informed consent and all the boundaries in which therapy must take place.
Yep. Exactly.
I think we talked about this a little bit, but maybe we can go into a little more. Is like, what are the risks of blurring the lines? Like, why is it so bad to blur the lines?
So everyone knows the Hippocratic Oath, right? First, do no harm. Most people don't know the second part of that, which is, and do the right by your patient. Mm-hmm. And so when we're talking about this space, we're not just talking about doing no harm, because you could absolutely do no harm if you're making recommendations to someone when you don't know them. Like, most people would not, if you ask a stranger on the street of like, hey, I've got ibuprofen versus Tylenol, which one should I take? Most people are going to go, I don't know, or they might have a couple ideas, but like, it could be confusing. And then a lot of people would be uncomfortable, or like, I've got this rash. Can I show you this rash on my butt? And can you tell me what to take for it? Most people are not going to want to engage in that whatsoever because they know they don't know.
Right.
And so the potential harm comes from someone who thinks they do know of, oh, I've seen that rash before. I used whatever product and it worked great. Well, what happens if the person goes and buys that product and they have an allergic reaction and they die? What happens? Like, there's just so many things that could end up hurting someone that you just want to avoid. And even if obviously death is the worst case scenario, but like, you can cause psychological distress. You can cause emotional harm. Especially if you are in a position of being a mental health provider and telling someone, oh, well, that experience isn't accurate, or that's not what I'm seeing. Because now you're moving into that therapeutic territory and space. And I probably forgot the main gist of this question. I'm sorry.
It was
distracted by the rash on the app.
Why is it so bad to blur the lines?
Oh, okay. So yeah, first and foremost, we want to not do any harm. And the best way to make sure that you're preventing harm is to know the person you're working with so that you can actually make good recommendations for them. But that second part of the Hippocratic Oath, actively do right. So it's not enough just not to hurt someone, but are you acting in their best interest? That kind of goes back to that consent question we asked earlier, is like, just because my client might be okay with me, if I wanted to go on Twitter and talk about a really interesting case that I'm dealing with and I got consent from my client to do so, well, legally, that's fine. I have consent to disclose this information, but that's sure as hell not ethical. And it's definitely not smart. because ultimately that is not in the best interest of my client. My client's not being served. Nothing is going to benefit them from coming from that. It's all about me and what I want. And so I'm not working in their best interest. And so that's why it's so bad to kind of, not just hurt, but in the helping profession, you want to not just not hurt, but like actively help people. And I know there's a lot of like double and triple negatives in there.
Right.
Yeah.
Also, I mean, you didn't mention this, but one thing that comes to my mind is that the lines are blurred. It implies that, someone is perceiving not therapy as therapy or something like that. One of the concerns that I have is that like they can have expectations that are not appropriate. Like, they can expect to be better, for example, to feel better. And then that might not, maybe that'll temporarily come true, or maybe it won't at all. And that can lead to disappointment or worse.
Okay. So if I'm hearing you right, it is a matter of if you're being perceived as, say, a mental health professional and someone is coming to you to get support, advice, whatever, one of the potential dangers in that kind of confusion is that they may expect to feel better. They may, and I think that's a really good point that you bring up, because like being very clear about your role when you are in a public space talking as a mental health provider is critically important, because you would never want someone to think that, or to come away from like a call-in show or something like that. You would never want someone to think that they now have a therapeutic relationship with you and that you are somehow now responsible for their care. Like that's no, because again, that is something that only happens within the contractual obligation of a therapist-client relationship. And so, yeah, if someone could definitely think that, oh, well, I was talking to Kelly and she gave me this really good advice, and now I'm going to go back to her because I have another problem and I want her to solve it. And maybe maybe I can't solve it. Maybe my advice is really bad and things get worse. Maybe I'm not available because I am not a concierge therapist, even to my own clients. I don't answer people's questions on demand.
Right.
This is my profession, and there needs to be some rules and regs around that. So yeah, expectations are super, super important when you're setting out your role in a public space of like, I'm just here to talk about education. I'm just here to provide support for resources and connecting people to ways they can find their own therapist or whatever. I am not here as your therapist.
Right. But even saying that I'm not here as your therapist is not enough, right? As we
I feel like it's
earlier.
the bare minimum. The bare minimum you could do. And so for some people, the bare minimum is going to be enough. Right. But for someone who's in distress, it might not be. And given the state of the mental health system in the US, at least, it's abysmal. It's awful. And so I never blame people or get angry with people for finding alternate ways to get their mental health care needs met, whether it's watching Dr. Phil or whomever, like they're in need of support and they don't have access to it. Either they don't know, or there's not enough money, or there's an insurance issue, or there's stigma. There's a million things that keep people from being able to get the help that they need. There's a waiting list. So I never blame them, but that doesn't mean that it's okay to then go out and provide services just out there in the public without, regard for things like safety and confidentiality.
Right. There's no, it doesn't excuse acting in a way that will lead people to have the false perception that they are receiving therapy, even if you were saying it's not therapy repeatedly.
Yeah.
That alone isn't enough. Your actions essentially speak louder than words.
Yes, because again, I can tell you this is not therapy. But then if I go into a conversation with you where I'm asking questions like, all right, and how did that make you feel? And what did your dad think of that? And tell me about another time that happened. And what physiological reactions come up for you when you think about that? Like, it's one of the things where you can know, like in your brain, no, this is not therapy. But at the same time, if you need support, that's in your mind maybe better than nothing. which means that treatment or conversations or anything that's going on between someone else, you're now applying to your own self. And yeah, as a mental health professional in the public, you have to be aware of that. You have to be aware if there's an audience that your words carry meaning and they carry power. And yes, absolutely have a disclaimer. Absolutely clarify your role. Be very, very clear and upfront. This is not therapy. I start every stream I have with, "Hi, everybody. I'm a psychologist, but I'm not your psychologist." Like, that's important. Have that come up repeatedly, as much as you need to say it. So it's an important part. So I'm not saying don't do that. It's a very, very important part of it. Mm-hmm. But even with that disclaimer, if you are using your licensure, if you are using your professional training or your status, so like that doctor label, as a means of like legitimizing yourself, then you also have to abide by those rules of the institutions that you are using as legitimizing agents. And so that means paying attention to your audience, if there is one, being mindful of the person you're talking to, and like, are you being invasive? Are you asking questions that are intended to evoke certain emotional responses? Are you using skills that you have only because of your training in order to get more to come out? And just being really, really mindful of that. And always to the point of, well, why? What, like, that's the question I always have, is why would anybody want to do therapy in public? Mm-hmm. That sounds like a horrible idea to me as a clinician. And I'm sure there would be people who would disagree, and that's fine. But I know the sessions that I have with my clients, I would never want that to happen in front of another soul, much less an audience. I would never want my client to be able to go back on a replay and watch them relive the worst moment of their life just because at the time they said they were okay with it.
Or have other people do it.
Or clip it, turn it into a meme. Like, I understand that there's difficulty. And so again, I would never blame a person for finding comfort in something like a Dr. Phil or any mental health provider who's out there who feels comfortable sharing their professional opinions in that way. Because again, if you're going to get your needs met. And if the healthcare system has failed you, then you're going to find another way to do it. But that means extra responsibility for us who are professionals, that like, it's not that we don't want to help. Believe me, we do. We do want to help. But like, these rules are there for a reason, and they're there to protect people who are vulnerable. And if you're seeking support for a mental health issue, it doesn't matter who you are vulnerable.
You said if you're using those tools or credentials to legitimize yourself. What do you mean by legitimize yourself, just for clarification?
Sure. So again, that's the difference of, "Hi, I'm Dr. Kelli Dunlap. I'm a licensed clinical psychologist," versus, "Hi, I'm Kelly."
Right.
Two radically different things. And so, one I'm using my training, my education, my training, and then my status as a licensed clinician. If I was board certified, I could throw that in there too. I'm a board certified clinical psychologist to make myself sound even fancier. I'm not, just to be very clear, I'm not board certified. But like, I'm using that to make myself, I'm a real psychologist. Mm-hmm. I'm not some person playing at therapist. I have these skills and credentials, and you should listen to me, because that's why we use titles to begin with. Is for people to pay attention and to go, yes, I know what I am talking about. But inherently, people then are going to believe what I say and buy into more of what I say, and are much more likely to take what I say as clinical advice or as medical advice, which I would never want to happen.
When you stream and you introduce yourself as a psychologist, you're basically, what makes it okay is that you go out of your way to make sure that everything you're doing on stream is strictly adhering to the code of ethics, right?
Absolutely. So I will introduce myself. "Hi, I'm Dr. Kelli Dunlap. I'm probably streaming some mental health game, Mm-hmm. That's what I do. Or Untitled Goose Game, because that game is just perfection. And so I might talk about it from like a clinical lens. Like, I've played Hellblade and I love that game to death. And I will break that game down as a psychologist and as a game designer. I could talk about, hey, the symptoms they're expressing here with psychosis is really on point. A lot of people who experience psychosis they feel like the world does shift. They feel like the voices are in 365. The voices can be mean, or sometimes they're supportive and sometimes they're loud. Like, this is a really good representation of psychosis, and here are some of the limitations. And so I'm talking about it from an educational perspective. But if I was to go, so if you experience these symptoms, then you have psychosis. And like, that's so it's a very hard line. And for anybody who's a mental health provider that does work on stream or in public, it's very, very challenging to walk that line. And I try to be pretty forgiving. But there are things like diagnostics, like specific treatment, and especially like, I can't stress enough, like medication.
Right.
Never make medication recommendations.
That one seems incredibly dangerous. Sure.
Yeah. Yeah.
So basically, the difference between like what you do would be mental health advocacy versus something that's more personalized, something that's more direct advice. You're saying things that can only be interpreted in a very general sense, so that no one person can be targeted by what you're saying, basically.
And so even if someone asked me a direct question, and this happens if you're a mental health professional on stream, someone's going to come in and trauma dump. Someone's going to come in and tell you about their horrible day and then just share like all these parts of your life. And other than the community management aspect of that, you don't want to be a robot and go, we cannot talk about that here. You don't want to be cold. If you're a mental health provider, you're probably very warm and squishy. It's okay to do things like to validate their feelings, to validate experiences, to see them as a human being. And it's also totally okay to say, there's a lot going on here. And I think that you need more than, just a vent. It sounds like you might need some more support. And then you direct. Mm-hmm. So like you can validate and direct. And that's probably about as closest to the therapy line as I personally would ever get. Other therapists may have different ideas. Again, there's not super great guidance, especially around something newer like Twitch. Most psychologists don't even know what Twitch is. So that can be very difficult, but it's really about, okay, I'm trying to put this person's needs first. Because let's say I went into therapy mode with them, it might help them. It might. It also might be detrimental because I don't know who this person is. What's the impact of the people on my community? What's the impact of the people who are watching this happen? There's too many variables for it to feel like a safe thing, much less something done in service in the best interest of the person who's in distress. Right. Like if you're in distress, what you need to do is reach out to crisis services. And if you're upset and you don't need crisis services, then, there are things like peer support and warm lines and other ways of connecting you to support. And if you don't know how to like walk through insurance, I can tell you how to do that because that's not clinical. That's just, living in America.
Right.
So yeah, there's always a difficult balance between being like wanting to be warm and supportive, but you cannot cross that treatment line.
As a psychologist who streams on Twitch, I'm not sure how to ask this. Okay, are there certain things that you just, aside from like, of course you wouldn't give out therapy, you wouldn't blur those lines, but are there other standards you would hold yourself to because people are perceiving you as a mental health professional?
I curse a lot on my streams. So, but of course, I will curse with my clients too, if they're cool with that. So I don't feel like that part of me is any different. Mm-hmm. I feel like when I show up to stream, it is me. I just happen to have a highly specialized area of knowledge that sometimes comes into play. So it's an interesting question. I think I show up as my genuine self. I don't think there's other things that I particularly would change.
Would you go on stream drunk?
I don't drink. So that's the thing is like, I just personally don't. So I could see that as being an issue, something that I keep in mind. And so this isn't on stream, but actually maybe Twitter would be a good equivalent is I have a public Twitter account and I tweet from there from my perspective. And, I put on there that, this is what I do. I also have a media release for my clients that talks about social media use. Like, hey, I'm a human. I'm a millennial. I exist on the social interwebs. One, like, I'll never follow you back because I won't follow, I lay out like what I will and will not do. If you want to follow my stuff, that's at your discretion, but like, I'm a human being, but I definitely think about what I tweet, probably more than most people. And I'm very careful with that because I mean, from the best case scenario of like someone comes across my Twitter feed is like, oh wow, my therapist swears, which I do, to worse scenarios that I've had happen where I've had clients stalk me and like track me down and come into session with information that I had put out on socials, which, that's a really weird place to be when someone knows something about you that you didn't tell them.
Mm-hmm.
And so, yeah, I think in that regard, I am more mindful of what I do and how I present. But for the most part, like I don't talk about my kids on stream. I don't really talk about my personal life. Even in Twitter, like my Facebook is locked down like, whoa. Because again, I'm always a psychologist. Even when I'm not on the clock, even when I've been very clear, like this is my personal space, if it's public or has the chance to be public, then it is always possible that someone could see me in my role as a psychologist and I can misrepresent myself or make the profession look bad. And so I work really, really hard to not have to worry about that by just not doing things that could be in a very public space be super, super questionable.
Right. But that's a personal choice, the way.
Yeah.
Okay.
The ethics code actually states that what psychologists do in their off time is their business. That the ethics code doesn't extend into a psychologist's personal life because that is unfair. But for me, it comes back to that like legal, smart, and ethical. And that's largely the smart part. Like, do I really want to put this out there? Knowing that it's public, knowing that it is possible a client could come across something that I have tweeted or said in a video. Like, do I want that out there? And if not, then I don't put it out there.
I'm just thinking of, let's call it a hypothetical situation.
Okay.
Where someone who has the credentials of a psychiatrist, and everyone knows that they have these credentials, is doing an AMA stream while intoxicated.
Okay.
It sounds to me like you personally would avoid that, but the APA and any organizations wouldn't really care as long as what's happening on stream doesn't ever enter the territory of blurring the lines or being therapy related.
Yeah. I mean, again, not something I would do. I mean, that's just not my thing in general. So I have a hard time speaking to that component of it. But yeah, I think mental health professionals are entitled to personal lives in their own time. Mm-hmm. Now, if you want to take that and put that in a public space, and if you are someone who is seeing clients, I think you should think really long and hard about making smart decisions. Mm-hmm. Either like I have a media contract that all of my clients get saying, hey, it is possible that you may see me on stream, you may see me on television, you may see me on panels at gaming events because I do a lot of talks, I do a lot of trainings. That's part of what I do. It's how I contribute back to the psychology community. Like, I think it's very important for me to do that. But it can be really jarring to see your therapist outside of a therapeutic context. It's kind of like seeing a teacher when you're out of school and you're like, no way, you actually exist outside of school. And so I have that on top of the fact that I usually try to have a somewhat professional image. But it's going to be different for everyone. I would just, if a friend came to me, if a psychologist came to me and was like, Kelly, I want to get started with streaming. How do I help them? Or how do I start? I would help them. And then if part of that was they show up to their stream, drunk off their ass, I would have questions for them. Hopefully not judgmental ones, because I try not to be judgmental. But I would ask them, like, what is the goal here? Like, if you're blowing off steam, that's fine. I get that. But is this the place that you really want to do that? Mm-hmm. Is this a smart decision that you're making? Because legal, yes, you're entitled to be drunk. Ethical, the APA guidelines clearly say that what you do on your off time is yours. But how would it feel if your client showed up at session the next day like, wow, do you know what you said while you were drunk?
Mm-hmm.
It just, it
Yeah.
has the potential for so many problems and so many like boundary violations. I would have questions and I would want to ask them about that. So not condemning them with a, or throwing the book at them, but like, do we need to talk about this? Like what, I would probably ask, what's going on?
Right. So it would raise flags for you personally, though in a technical sense, it's not like a blanket good or bad or whatever.
I would have questions about I would have questions about decision making and like making smart decisions.
Mm-hmm.
That would be the first and foremost. Um, but like that's not something, again, if it was just, if you happen to be a psychiatrist and you happen to be on your channel and you happen to be drunk and just playing Fallout guys, oh my God, Fall Guys, Fallout or Fall Guys. And that's how you're blowing off steam for the day. Okay. Like, not my bag. I don't think but it's also like not my life. You're not doing harm. Now, if you're trying to therapize that, that's not, then becomes a clinical issue.
Right.
But if you're just off steam and that's the way you're doing it, okay.
I feel like this question, I have this written down, but it might not even, I feel like it's already kind of been answered. But it was just like, if, you have something where it's kind of unclear whether it is or isn't therapy, but the person who's in the role of the therapist is talking a lot, which doesn't happen in therapy so much.
Depends on the kind of therapy.
So you're saying that in therapy, the therapist can actually be in a position where they're talking a lot.
Yes.
So yeah,
Either because that's the modality that they're trained in. Like there are specific modalities where, like, I mean, I think a lot of people think about something that's more like psychoanalytic, where it's like, okay, free associate, just talk to me about what comes off the top of your head.
mm-hmm.
Whereas something which I think a lot of people just think that that's what a lot of therapy is. But for me, I like to say I'm an action therapist. I'm much more hands-on. Tell me what that means. I don't quite understand. You're saying this, and this is what I'm hearing. Is that accurate? I talk probably a lot. So it can be modality, or you could just have a bad therapist. Like if you feel like your therapist is dominating the time
Right.
and you wish they would shut up, then maybe they're just a bad therapist or not a good fit for you.
Right, but that doesn't really make something any less therapy, even if they are being a bad therapist.
Yeah.
So some of these grayer issues we talked about, like therapy entertainment, you mentioned that it's gray and that a lot of people, it's not like a objectively decided upon thing in the clinical community. Like how, for example, with something like Dr. Phil, how split would the clinical sphere be on what he does? Because I got a sense of your views on it, but like, is it like, do people typically align with the way you see it? Is it 50-50, or do people typically see differently from you?
With Dr. Phil, it's pretty much a universal, like, I'm so glad he's not ours.
Right. Interesting.
Yeah. I mean, I don't think I've ever met, not that they don't exist. I've never met a clinician who was like, yeah, Dr. Phil, he's doing good work. Like, no. And it just, I mean, that idea of therapeutic entertainment or therapy entertainment makes my skin crawl. It's like the point of therapy is not entertainment. The point of therapy is like growth and healing and working really, really hard to better yourself and to improve the situation that you're in, not to entertain a crowd, not to, that's.
But there is a recognition that if done well enough, therapy entertainments could be used to like help a lot of people at once, no? Or I guess you were saying earlier that mass therapy doesn't really work because you need it to be like personalized.
Yeah. I mean, I would ask for an example of what, if we're wanting to talk about therapy entertainment, like, because I can tell you for Dr. Phil, there's no, to my knowledge, there is no respect whatsoever for him as a mental health provider. One, because he's an entertainer.
Right.
He is a talk show host. He is, he's very clearly not a therapist and doesn't have a practice. He's not licensed. He doesn't see clients. Like, yeah. And what he does do on TV is cringe and uncomfortable.
Right. Okay, well, it's I think it is pretty useful to know that Dr. Phil is seen as fairly unanimously, the clinical sphere is not in great support of what he's doing.
No. I mean, a better approximation might be sorry, my cats are now trying to murder each other. A better approximation might be like call-in talk shows, because there are a lot of those. Like, I think Dr. Laura Schlesinger is one of them. That might be just because I'm old, and that was one that I think my grandparents listened to. And yeah, psychologists are routinely called on to talk shows and things like that to answer these kinds of questions. And so typically, if they're doing it well, they will take an individualized question and then they will make it a broader answer. So like, Timmy wrote in because he's feeling X, Y, and Z, and he thinks that he has depression and da 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 da. And then it becomes on the person who's the professional in that situation to respond in a way that is not giving advice, but is still validating and like helps people have a better understanding of what's going on. It's very tricky and it's very difficult, which is why most mental health professionals don't do it. I would say maybe 1% of providers will do any kind of public speaking, because it's really hard to go, wow, to me, that sounds like you're going through a lot. If you're not already, you may want to consider going to see a mental health professional, because some of the things you're describing are consistent with, depression. Depression, as we know, is this constellation of symptoms. And, obviously you would need to be assessed in order to really, to get that diagnosis. But it sounds like something it's really difficult for you and you can use some support for. So you take it from the individual and then you expand it. So that way it's not an individual recommendation, but like, hey, if you're feeling like Timmy, if you're having these similar symptoms, it would be a good time to go get help. It would be a good time to talk to somebody, or, your pastor, your therapist, your whatever.
But wouldn't saying, hey, some of these symptoms is consistent with what we call depression, isn't that already getting to the area of like individualized diagnosis?
That's the hard part. Like that's the thin line, and that is that gray area. Because you're not saying you have depression, and you're not saying you don't have depression. You're saying the symptoms that you're presenting with sound similar to symptoms that you might see with someone who has depression.
Right.
And I know that's splitting hairs, and I know it's all semantics.
It seems like it comes down to like the lack of a definitive statement.
Yeah, I mean it feels almost like a politician, and like you can't really give a direct answer.
Right.
But that's exactly it. Like if someone's calling in and you've talked to them for 5 minutes, there's absolutely no way you could give a diagnosis. Absolutely not.
Of course. Okay. I don't have any more questions that we've gone through all. Let me just quickly read through them just to make sure, but I know it looked like we got through all of them.
Cool.
Okay. Yeah, so thank you. I really appreciate having this conversation. I am slightly terrified that the video file isn't going to work, because I noticed just 5 minutes ago that my hard drive was running out of space, so I just quickly moved stuff to my external drive. I don't really know how the recording process works, but I'm hoping that when I press stop recording, it'll be fine.
My fingers are crossed for you. Oh my goodness.
Yeah, oh my goodness. This is my bad. I screwed up. I should have realized that I had such little space. I'm gonna hit stop recording now. I guess we'll find out if it works.